producing, so what PPE do we need for a droplet producing procedure?
Gown, mask, and shoes.
We don't have to have a gown. Droplet is universal, which is what? Hand washing plus gloves. Standard or universal precautions.
I see at my job.
Droplet,
They use a gown.
I use a gown too, but that's
Okay.
to protect number one, me.
Gotcha, okay.
But for droplet precautions as described by the CDC, you're adding a mask and eye protection. So if you add a mask with a shield, you're good. But for the purposes of the checkoff, you wouldn't be able to understand me. So we're going to operate on the presumption that I have a mask on with eye protection. So I perform my hand hygiene. I am getting into my standard precautions. I would have had my mask with my shield on. What are we going to check before we even go in the patient's room?
Order.
Check for an order.
Past medical history.
So we're looking in the chart, past medical history, medications, chief complaint.
Did you say medications already?
Medications, sure, home and current.
Allergies.
Jackie, do you have one? Yeah, see what previous assessment has been charted.
Imaging?
Imaging, so like diagnostic testing.
Lab values.
Lab values.
The breath sounds.
Yeah, previous breath sounds, Maria.
Social history.
Social history, yes. Asi?
I was going to say, what brought they in? So somebody said that already.
Okay. We might want to look at surgical history. We might want to know how long they've had their trach. Wouldn't that be important to know? When they were trached, why they were trached. I think we covered a lot of it. So, like, you know, we're going to ask this every time we do a checkoff. Supplies that I'm going to need. I'm going to need my trach care kit. I probably would like to have a Chucks for keeping things clean. I would need a trach tie. In this case, we will be cleaning and replacing the inner cannula. This would be disposable, typically. But for the purposes of our lab, we are going to remove it, we're going to clean it, we're going to place it back in, okay? This would typically be disposable though. So to begin, I have my patient on trach collar, hooked to an all-purpose jet nabbit, whatever therapy they're on. I would have checked my patient's armband, verified their name and birth date, and I would say, hi, mister, we call him Stan because he stands up. I would talk to my patient, hi, Mr. Stan, I'm Jen from Respiratory. I'm here to perform some trach care on you. We're gonna get that cleaned up. I'm gonna change your inner cannula. We'll suction out any mucus if we need to and get you feeling better. So I would start by placing my chuck down on the patient's chest. This is a droplet and mucus producing procedure, so you want to keep everything clean. I would have my ambu bag ready to go, hooked up, ready to go if I need it. I would have a suction kit available for suction with trach care. I would have my suction turned on to what pressure? Negative 80 to negative 120 centimeters of water or millimeters of mercury, and I would have that available should I need it. I typically like to open the things that I need before I get sterile, so I would probably also open my new trach tie because we're going to change a trach tie. We do trach care typically BID once a shift and as needed, so if it's looking a certain way, you will take care of it again. And it's ordered that way, typically BID and PRN. That would be our order. So I'm going to open up my trach care kit. This is sterile until proven otherwise, okay? So when you open it, don't do a bunch of touching on here. What comes out on top is a sterile drape and gloves. So I'm going to just pick that sterile drape up as easily as I can without touching anything else. I'm going to open this up to create my sterile field. What part of this procedure is sterile again?
Inner cannula.
The inner cannula. Oh, I also have my water. I forgot to mention that. My water is available. So I am going to create my sterile field here. When I am opening the kit, I don't want to touch everything in here because it's still sterile, right? Dump it out on top of your sterile field. Did you notice I didn't do this? Because if I did that, what am I doing? Breaking my sterile field. So just dump it, move that to the side. These are my sterile gloves.
Professor Quinn, I was teaching them the other day to fill the water up, get the trach and inner cannula, and then go sterile.
smart.
I don't know if
Okay.
that'll make it easier for you.
No,
It's
perhaps
totally
it
up to
will.
you.
Okay, so we'll put our water in, and we can take our inner cannula out. That's a good point.
I mean, either way is totally
Yeah.
good. Yeah.
This twist to lock, so you untwist it, stabilize the trach to remove the inner cannula. You don't want to be yanking on their trach, and start to do the dishes. We're going to do the dishes.
So you don't have to be sterile to take out the inner cannula?
When we put it back in, we're
We'll
going
put
to
it back in, get it sterile, okay, okay.
So I've replaced the oxygen over the patient's trach so that they stay safe. I have them on the monitor. We've assessed them. I did breath sounds. We got their vitals. They're on the monitor. I can see the monitor to monitor their oxygen. Okay, so we have our water. We have our inner cannula out. Now we have to get a hold of these sterile gloves that came out in a fun way. So the first one, I'm going to touch just the inside, right? I'm going to slide that puppy on. I'm ripping the glove already, but we do the best we can. The next one I can cuff, pull it on, and I am sterile now. So I need to do my dishes. I am looking for the scrub brush that looks like what y'all use to clean your straws on your Stanleys these days. Okay? We are going to do the dishes. I personally just do the dishes over the bin that I'm in. When you push your straw cleaner through the trach, a glob will usually come out. Professor Klima likes to do that initial over a trash can to get rid of the glob. I just get it in here. I clean, 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 clean. And then one of my other bins will be my rinse. So I'm gonna rinse, I'm gonna make sure that I have all of the visible debris off of the inner cannula. And then we will dry it. So you can take one of your gauze and dry your inner cannula. Well, that's, yeah. And dry your inner cannula. So I'm gonna dry it, and I'm gonna get rid of my garbage. You can put it in a garbage can. I like another Chucks that's my dirty Chucks, and I put everything dirty on there to keep it separate. So we are sterile. You're going to have a clean hand, move the trach mask, use your other hand, stabilize the trach, and slide that inner cannula in the way, kind of like how we put a nasal cannula in, curve down. Same way with trach. Put it in, curve matching the trach. So now we are done with the inner cannula. We're moving on to the clean portion. I like to take my gloves off because these are probably wet and icky. I get rid of my dirty gloves and I put those over here on my dirty Chucks. Get rid of it. Next, we will remove the drain sponge. That is a gauze. Depending on what they do at the place you're at, it may be a different material, but it is a gauze that comes with a split already in it, okay? So I'm gonna take the old one out gently. You just kind of shimmy, 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 shimmy. And that is trash. I usually take a look at it to see what kind of secretions we're dealing with at the stoma. That is trash. I have one part of my basin left that I did not yet dirty or rinse in. My way to do trach care, I like to open up the gauze, fold it in half, get the middle wet, give it a squeeze, you don't want to drown them, and I clean around the stoma by sliding the gauze up under, and I kind of do like a seesaw, not hard because you don't want to hurt them, around the stoma. This is a good time to get a look at the stoma. Don't pull the whole trach, but you can pull just the flange back. It's soft plastic. And you get a look at the stoma. Is there anything dried there? Is the skin intact? Are there dried secretions? Is there blood? when you're cleaning, that's the time we want to be looking at the skin. So I do one side, I pull it out, I get rid of it. I do the other side. Dip, dip, squeeze, squeeze. And when I do this, I make sure to get like on the bottom portion, on the top portion. This also helps clean the flange. And then I pull that out. Based on what I see, I may take swabs and clean additionally around the skin if I need to. I may take the pipe cleaners that come in here, dip, dip, to help clean the flange. There's often things dried on the trach itself. You want to have that in good condition too, because we're just asking for infection if we leave that dirty. In addition, I sometimes wet this, I sometimes don't. Maybe a little wet. And I like to give a wipe around the areas where the trach tie is, because that can get soiled, it can become sore, you can have non-intact skin around the back of the neck as well. So I usually give a good wipe, get a look at that. If it looks clean, I'm good. If it looks dirty, I go again. But you know, this trach tie belongs to us and we want to make sure that it's in good condition. So at this point, we're nice and clean. We've changed our inner cannula. We can get our new drain sponge in. So when I do the new drain sponge, I bring one side up through the tie basically, and then I kind of shimmy it under this flange while I pull it up. I do the same thing on the other side, tuck it under, shimmy it up, and you want it to be nice and flat. You don't want it to be bunched up under the trach tie. You can pull it up so that the bottom of the hole is against the trach itself. So this protects their skin from contact with plastic. It can help absorb some of the moisture associated with the trach. So that's good.
When would you change the trach ties?
We're getting it. Where did it go? Thank you. In my everyday practice as a respiratory therapist, I change the trach tie and the sponge at the same time. But we're new and we're learning, so we're just making it an easy process. Trach tie is in two pieces. So each end has the little tabs. This is what attaches to the trach flange to hold the trach in place. It also has this movable tab so that you can get a good fit on your patient. My trick, I very lightly loop the ends of my new one back onto itself so that I can kind of pop it off easily when I need to use it. It helps with coordination. I pre-measure my trach tie before I disconnect anything to make sure that I'm in a good range for size. And I'm a little short, so I can take that tab off and move it up a bit. And then I'm gonna just check again. You kind of want the edge of the trach tie to be right at the edge of your flange. So that looks good to me. I'm going to get ready to change the trach tie. Now, in doing this, you can get that out of the way for this portion. You never take your hands off this trach when you are changing the trach tie. They only have to cough slightly for this trach to go flying. The only time I've ever really stopped a student mid-care was when they took their hands off of the patient's trach in a clinical, and I was like, nope, stop, put your hands back on that trach. So it's very important. You do not want to lose the airway for the patient. So here's my new one with its little tiny loop. I'm going to keep a hand on the trach at all times. I'm pulling back the tab here. When I take the old one off, I fold this back on itself like this so that it doesn't get caught on anything going through. Now I'm going to pop that loop. You can pull the edge of the flange up. It's malleable. You can move it. And I am going to feed the new white tab through the trach flange, still never taking my hands off. I'm going to pull it through till the end of the trach tie is against the flange. I'm still holding. I'm going to come over here, pull the old one out. I'm going to get rid of the old one. And I throw that in my trash pile so it's not in the way. Bring your trach tie around, pop that tab, pull the edge of that flange up, feed it through, pull it tight. You're not done yet. You need to make sure it is a good fit. When we put a trach tie on, we want to be able to get 2 to 3 fingers in the trach tie to make sure it's not too tight. So I can get 3 fingers in there. It's not too loose. It's not hanging down around the neck here. That would be a good fit. Make sure you check because it looks fit here and it could be hanging behind their neck. And again, we never want to be the reason a patient loses an airway. So we are going to put our oxygen back in place. It's very likely you will have to suction a patient during trach care, very likely. You're touching their trach, you're manipulating it, they're going to cough, they're going to produce sputum. So then you would have your sterile suction procedure also. What are we going to document for trach care? Everybody can give me an answer. What are we going to document?
Time and date.
Time and date? Yeah, if they produce sputum and if you had to suction them.
The patient reaction for the treatment or the
Yeah,
patient was.
yeah, how did they
about to
react?
come
Or their subjective feeling?
Condition of the patient, like was their skin intact? Or
Skin assessment, device-related skin assessment. Very, very on the radar and very topical.
The amount of sputum produced, if any.
Yep, the amount of sputum produced, yep.
Stoma.
How their stoma looked, sure, that would be like device-related skin
I was
assessment.
gonna say skin.
Okay,
I was gonna say patient reaction.
yes. Are there any numbers that we care about?
Oh.
Vitals, we would absolutely be looking at vitals because we're kind of like on and off, on and off. Breath sounds for sure. What you did, that you changed the drain sponge, that you changed the trach tie, that you cleaned the inner cannula.
If you suctioned.
If you suctioned, sure. We also will always be documenting trach type, trach size. So this one in particular is a Shiley uncuffed 6. So we would absolutely be documenting trach type, trach size. Typically you would write your name, date, name, date, time, or initial date, time on the trach tie so that the next person coming after you, if I handed this patient off today, they would know, oh, Professor Quinn did trach care at this time, so I can approximate what time I'm going to do it.